My name is Brooke Allendorf, and this is my Project 2, Part 2. For question number 1, why is language sampling important? Language samples provide some of the most useful information that we can gather about a child's communication. Also, a language sample provides a great deal of information on a child's language abilities and overall conversational skills. For question number 2, how was a language sample completed, and what are some tips for collecting a language sample? So first off, to complete a language sample, SLPs must find the MLU. The MLU stands for the mean language utterance. To calculate the MLU, an SLP would count the number of morphemes in every single child's utterance and add up all the morphemes and divide by the total number of utterances. Some tips for collecting a language sample would be using picture books, especially non-fiction books with pictures seem to work the best for language samples. Also, open-ended questions, propelling words, sabotage, and having the child tell a story or retell a story. For question number 3, what do we expect in typically developing children related to language development, and also discuss the highlights of what we expect to see at each age level in the domains of form, content, and use. So starting at 6 to 9 months, babies begin making sounds, babbling, saying combinations like dada, mama, baba. Babies should be able to recognize their mother's voice at 6 to 9 months also. At 12 to 15 months, babies say their first real word. Their vocabulary grows to around 10 plus words. They start playing peekaboo and can understand simple request. At 18 to 24 months, spoken vocabulary grows quickly. They can start saying 2-word combinations. They're using words during pretend play and producing questions and statements. At the age of 3, they start play acting in everyday routines. They ask how and why questions, and they start interacting with other children. At age 4, they start saying more complex sentences. They can understand complex instructions, and they can start combining 4+ words. At age 5, they can say 2,000+ words. They can start speaking first and last names, and they can understand 10,000+ words. For the last question, question number 4, how does language sampling help us determine a language differences versus a language disorder? So a language difference is having the ability to speak another language that is different from the language used for instruction or used by the majority of people. With that being said, language differences are not an indication of a language disorder. A language disorder is a communication disorder in which a person has difficulties in learning and using various forms of language, such as spoken language and written language or sign language. Individuals with language disorders have a language ability that is below those expected for their age, which limits their ability to communicate or participate in many social or academic or professional environments. So to answer the question, how does language sampling help us determine the difference? So by comparing the child's MLU age to equivalent charts would be the next step. If the child's MLU is within his age equivalent range, then there's a good chance that his expressive language skills are developing correctly. But if the child's MLU is clearly off from a normal developing child, there is a good chance that this child has a disorder.